Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. You'll also hear from Bent Brayman, our media and graphics design producer here at the Exam Room podcast. Bent brings over a decade of experience producing multimedia content in the healthcare space, including work with major organizations like the Core Institute and the University of Phoenix. From video production to motion graphics and audio storytelling, he's the creative mind behind how this podcast looks, sounds, and feels. And when he joins the conversation, he brings a unique perspective grounded in both design and real-world healthcare experience. In value-based care, data is everything. But what do you do when it's always late? In this episode of the Exam Room podcast, Dr. Rhiannon Winsor is joined once again by Shaun Romero to talk dashboards, forecasting, and smarter patient communication. If your clinic is overwhelmed by lagging data or struggling to coordinate care, this episode is packed with actionable insights. Let's dive into the future of data-driven care.
So we talked a little bit about leveraging data. I know that's one of the complaints that our FQHCs have is the latency in data. We're setting up some dashboards for them, and right now they're kind of basic is my understanding, but as time goes on, they'll be able to drill down, and we're creating tutorials for them and those kinds of things. So my question for you is, how can FQHCs more effectively use data to improve operations despite the lag in the data?
If we're going to assume the lag is just, it's going to be there, what they can do right now is they can look at automating processes that maybe they're having people do manually. If you're able to pull information in from an HIE, if you're able to pull discharge information quickly into the EHR and have it in the system for the provider and do that in an automated way, that's one huge thing. So if you can, at least they can shorten the latency on that end when it comes to the acquisition of data, and in turn kind of shorten the reporting, the claims lag in a sense, back and forth from the ACO to them. That's the first thing is making sure they've got a process in place that doesn't rely on a person to pull it, because that's a burnout scenario for that individual. Having an action point system where the providers have a good way to follow up on patients who need to come in, who are prioritized for whatever reason because of a care scenario they haven't followed up. They have multiple conditions that relate to the higher risk of admittance into a hospital. Having a way to automate that follow-up, that recall process is another element to it. Obviously, if you're not able to resolve certain metrics because patients aren't coming in, then it's just that metric's always going to suffer. So having a good outreach program that isn't someone going down a list and just calling people, and having that continuity of when they were last seen, and then having that next visit scheduled, and not just, hey, I'm going down the list and your name popped up. Like, you don't want those scenarios. You want it more customized. So I think that's another way that you can get around what is going to later on add to that lag of information back and forth, that quality information. There's I've seen a lot of groups do like a lot of templating where they'll have a template of just all the stuff they want to hit during the visit, and just rest on that being comprehensive enough that they cover what could potentially come up, Another one is, we talked about open lines of communication, not only for the provider team, but also the patient to the provider. So using systems that make it as easy as possible for a patient to communicate back to the provider. And text messaging is, I think, one of the easiest ways. The last thing as a clinic we want to do is tell people, hey, we have an app, or we have the patient portal. We had those, but the amount of people who used it was very low compared to people who responded with a text message, a secure text message. And that's the key, is having a message that gets the response back in a secure way that is okay, I'm able to, whether it's electronic forms, whatever's needed, hey, can you fill out this survey, this whatever it might be, getting that communication from the clinic to the patient and back to the clinic in a very, very seamless way is important. Because again, that's another thing that will delay the quality of what's going on. Hey, reach out to me when you get that mammogram, when you have that colorectal screen, let me know. Just text me back, and that way, so shortening the time it takes as opposed to, okay, we saw you, oh, you got that 4 months ago. Okay, well, I wish I knew about that. You know, that delay on the front end makes the delay just much worse overall for the back end. In the back end being, again, the clinic to the ACO and back.
And making sure it's timely too. I know that I just went and had some lab work done, and then I get a text message like, oh, your results are in. It was like the very next day. It was like, okay. So I click on the link, I go to the portal. Well, they hadn't been reviewed by the physician yet, but I'm getting this, so I've been in healthcare long enough that I can read my labs, but most people can't, right? So I could see where that could be a little bit of a frustration where you're like, okay, I'm going to get to see my results. And then you go in and, well, it says, they haven't been reviewed by your clinician yet. So making it timely, the timing of it, that's a really easy way to communicate is through that text messaging. I mean, I think I prefer it myself.
And with the big, beautiful bill that's coming out now, there's a lot of money going to be pushed into rural federally qualified health centers. And so that's a good thing. I think there's $16 billion they're pulling out of the budget. They're $50 billion they're putting in, and they're going to claw back $16 billion. So there's a give and take, and then there's a portion of that goes towards improving the access to care in those rural areas. So there's a lot of opportunity there to kind of build systems in that improve communication, improve quality, reduce latency. But a lot of times it's going to come down to just the simple things, like if the clinic has good communication channel to the patient, if the specialists that they're referred out to are communicating back and getting that data quickly. I know one of the challenges that we've seen is that a lot of clinics are calling specialists, begging for notes, trying to close that referral loop. And that's a delay. And so you like you said, you log into the portal and you're like, the provider hasn't looked at my information yet. Well, it's because they're inundated with everything else. They're running ragged, but they're also in the background. There's someone hounding someone else for patient data so they can make a decision. And so you, as a clinic, you almost need to figure out, are we going to refer to this specialist when we know that 9 times out of 10, we leave a message and no one gets back to us. We know the patient saw them. They said they were waiting to schedule a visit until we have that follow-up with information. So there's the communication channel is I guess the first thing you can really work on to reduce latency. And that's a big challenge, but an easy fix in the sense of patients have cell phones, you can text, you can get that, follow-up quickly. Now the back end, challenge is much different, but there are solutions and things to that, but it's it's more of a system-wide approach.
So I hear our internal data teams talk a lot about forecasting. Is that something that can be automated or leveraged in some way?
A lot of forecasting, a lot of KPIs and goals are set with the expectation that we're going to get to this point. But the challenge a lot of times is no one's really looking at insights to see the trend there. Like for a clinic, a lot of times we'd have insurance companies come in and say, hey, here's where you're at, but the information's 60 to 90 days old, right? So that's not helpful. And ACOs and payers have the same issue. We're going to set a goal. We want to get here at the beginning of the year. This is what we're going to be at the end of the year. But during that path there, a lot of analytics are used to chart where they're going based on information they know now, but there isn't any real-time feedback on insights about, are they trending that way? Are the clinics trending that way? Clinic over here on Scottsdale just had 2 providers quit. Now they have another provider starting next month. what does that drop do to where we need to be? And as a group, there's going to be a lot of shifting around when it comes to those things, and maybe PTO and time off. So there's a lot of things that are going to immediately change the direction. How do you quickly adjust for that trend, so you get where you want to go? So a lot of times that delay in data, I think from what I've seen, a lot of times doesn't allow groups and insurance and ACO to really make meaningful insights on where we at right now. And do we need to quickly change a few things so we can get where we need to be? Because optimistically, we all want to be at that final number. That's a good number for everyone. That's a good metric for all patients. But are we trending that way with insights that we see? So there are automated tools and solutions. And we were using one where you can see, okay, well, the feedback loop was shortened to a week or so between us and the payer, as opposed to waiting for that claims lag to come through and the reporting mechanism to come through. So shortening that communication lag was the first step towards that. Getting valuable insights so that you can make adjustments towards your trend and towards your goal is hugely difficult with the current state of the way things are right now. Yeah, you have to have access almost. The ACOs need to have access. The only way I can see it would work is there's two ways. The ACOs have direct access into the provider's systems, and they're able to extract data, quality data, based on a cadence of 24, 48 hours, and get that information into a dashboard or a quality system, and then say, okay, well, here's where we're trending. Provider XYZ, they're not doing what they need to do 20% of the time. It gives that ACO in that scenario the ability to say, okay, where are the underperforming 10% of providers? Let's focus on them. And that's going to change a lot of where we need to be very quickly than just focus on everyone, just kind of, So the other element is the provider contributes to an exchange network, HIE, contexture, and then the ACO pulls from that on a regular basis. The challenge there is a lot of clinics don't connect into HIEs that way. Again, going back to our earlier conversation, EHRs historically make it difficult to integrate. The timelines are challenging. Contexture charges a cost. The EHR charges a cost. Margins are thin, and that's a hard stop a lot of times right there. Yeah. So the ACO is connecting to that data in a very meaningful way that doesn't, offload the cost to the providers, is a way for them to then pull metrics and say, okay, well, here's where we're at now, and here's where we need to be, and here's what we can do to get there.
Do you see a future where all EHRs talk to each other?
Not easily. No, I mean, because EHRs are really, historically, they're built to keep the information on their end difficult to use unless you're using their systems, their partners. And so I don't see, even with like the HIE is like a good universal bridge for all of that. And I originally, before it was Contexture, was Health Current, we were excited to join the HIE. But at that beginning, in the infancy, it was so difficult because we get papers, PDFs 30, 40, 50, 200 pages per patient. And it was unfiltered. It was just too much data. And it was difficult. You need to kind of, I have a little bit of an IT background. It made it for clinics who didn't have IT support. No. Impossible. And then if you're, there's a number of different closed, HIEs kind of that are not really connected up and they don't communicate to one another. And so having a universal HIE where providers are incentivized to communicate into it is the first step to really universalize that information. The problem is you've got, like I mentioned, Contexture is now going to start charging, and there's other things that now get in the way of providers. Like, well, I don't see the perceived immediate benefit to be in this, so I'm just going to keep doing business as usual. And again, it pushes them back to the business as usual, the old chassis in a sense. But EHRs communicating directly together, no, I think that's going to always be a pain point. Yeah, you have to implement.
So much easier.
Oh, it would be huge.
Wow.
It would resolve so many issues. And talking to a hospital system in Tucson a couple of days ago, that's one of their challenges is they log into other hospital systems and they want to get those records directly, And so they're having to do direct connections. Well, that's endless. And if you've got an insurance payer who says, okay, we'll accept your data, the other ones won't. They'll maybe have a different method for you to communicate with them. And so there is no universal communication method. And obviously with like HL7s and APIs, there's ways to communicate, but they're all very structured and they're very controlled. And there either some new legislation or something would have to change that would be huge for EHRs to want to or have to communicate and make it easy and shorten just even the integration timelines for things.
Yeah, I know it's nice, like being within the Honor Health system, let's say, like, if you go to someone that's within Honor Health, like they all have your information. They all,
Yep.
talk to each other. And that's really nice because that's less work for me as the patient to make sure that Dr. So-and-so sends something to Dr. So-and-so or whatever.
Right. Yeah. And those closed network HIEs are definitely, they're structured that way. They're referring you in the network. You're staying all within that same ecosystem, and data is easily controlled that way. But it's not the scenario for a majority of people, for sure. Yeah.
Well, as we are wrapping up, I think I've picked your brain a lot today. Is there any last thoughts, anything that we didn't get to talk about that you would like to share?
Yeah, I'm just excited to see kind of where value-based care is going to go in the near future. I think that there's going to be a lot more focus on the quality of care. I think that there's going to be an inflection point where providers and clinics realize that, it's not getting any better unless we make a substantial change. And I think patients and providers are going to help fuel that change because you're going to have patients who are not wanting to feel like a number. They're not wanting to go to a provider that the group they've seen 10 to different providers with. They want to have that relationship. So I think that relationship-centered care is going to push the forefront of a lot of value-based care. And I think with collaboration and empowering providers with more tools to be able to provide quality of care to the whole body, I think is instrumental. So yeah, it's going to be exciting to see how things evolve.
Indeed. Thank you so much for joining us today.
Thank you. Thank you for having
Really
me.
appreciate having you and for this engaging conversation. If somebody would like to connect with you, how can they do that?
You can go to medwestconnect.com or you can email me at Shaun, SHAUN, at medwestconnect.com. And yeah.
Awesome. We'll be sure to put that information in the show notes for our listeners. And until next time.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.